Okay. Well, we're not a lot, so maybe we can open the cameras and then introduce everybody, because this is the whole point. It's a thinking group. Hey.
Hey, great idea, Uri. So we can start with the introduction, because this is not a webinar of one just presenting. It's just a collaboration and trying to build something together. We will introduce our objective for today later on. So maybe I will start. I'm Pablo Velasco. I'm a pediatric hematologist in Valdebron Hospital in Barcelona, and now involved in this project where we definitely need your help. That is building the AI working group in SIOP. Maybe Uri?
Yes, I'm Uri. I'm a pediatric oncologist by training, but I finished the PhD in the Maxima. I was trained in Israel and the UK. Now I'm leading the innovation center at the Maxima, working on several AI projects, doing some research with AI, and yeah, mainly this. And so that's a game. Everybody give their permission to the next person, right? This is the game until the end. So, Jaques, you're the next.
So I'm Jaques van Heerden. I'm just gate crashing this party. No, I'm the coming vice chair for the Global Health Network, and I also did a study for AI to see what's happening in Africa, and then I waved it in front of Uri and Pablo, and they were like, "Yes, yes." That is where I fit in.
Brilliant. Now you need to choose the next one.
Julia.
Julia.
Go,
Good
Julia.
morning. Good morning. Hi, Jack. Hi, everybody. I'm Julia Challenor. I live in California, so it's 6 o'clock in the morning right now. But I'm grateful. I'm grateful that you had it now, because a lot of times people make it in Europe for 2 o'clock, in which case I'm like, I cannot do 5 a.m. anymore. I'm a pediatric oncology nurse. I work for the last 30 years only in low and middle income countries. And I've been here in California and my University of California, San Francisco. I took a workshop on AI because I had I have both admiration and skepticism. But when I heard that SIOP GHM was going to make an AI working group, I said, oh, this I have to see for how they think it's going to happen in low and middle income countries. So when I attended your first webinar, then I understood at least what you're doing in your countries, which I thought was fantastic. But how it applies in a lower middle income country where I work is going to be interesting to see how it goes. So I thought, well, I should at least be paying attention and see how they think it might work in low and middle income countries. Or really, honestly, it's the people I work with say everybody has a lower middle income setting or a resource limited setting in their country, even the US. So I think if we could say we certainly have a divide in the United States who has access to AI and who doesn't. So we're not just all blanket one thing. I think that kind of discussion would be great. But for rural health, I think for sure this is going to be the future. And I can see it in the literature as well. But go ahead. I'll pick Jimena. Go ahead and you go next.
Thank you, Julia. Well, I am glad that I joined this I don't know, meeting webinar. My name is Jimena Garcia. I am a pediatric palliative care physician trained in Colombia. But 4 years ago, I joined St. Jude, and I'm based in Miami, and I'm the program manager of the Global Palliative Care Program. I have incorporated AI in my daily basis, and every day I'm even more, I would say, in love of AI. Recently, we had a meeting with, I organized a meeting with the WHO, the Palliative Care Working Group, and we incorporate a lot of AI, like Undermine, Prompt AI, well, again, ChatGPT and others, and all the participants were like so surprised and just give me more, more reasons to say this is the right pathway. I need to learn more, and so I'm glad and can't wait to see what we are going to accomplish together. So thank you. And I'll pick Anelia.
Hi all, I'm Anelia Tanasova. I'm part of the SIOP office team, and I'm involved in all administrative staffs and supporting networks, working groups, and committees. I'm very happy that we have this new AI working group, and it's so engaging, and most of our members have really big interest in being involved. So I don't see other cameras on, but maybe giving the floor to Samuel Makuti. And then who else could not succeed to present himself, maybe type in the chat his name and contacts. Thank you.
Yeah, that will be great if you open the camera so we can create discussion. And I think this is really, really important for us because, we started this group with several people coming from not low and middle income countries in a way. And we can think that we know what are the problem in other country, but we cannot really think what are the problem and how we can solve them with AI. But so we really want to open this discussion here in this group to hear what do you think. Maybe and Pablo will have an agenda, but if you can do the introduction in one or two sentences, then we can go to the agenda of the meeting. That would be great.
All right, thank you. I'm Sam Makuti from Malawi. I'm working with the Global Hope Malawi. We are doing pediatric cancer at Kamuzu Central Hospital. I'm part of the scientific committee for SIOP, and I'm working as a senior monitoring and evaluation officer. But currently I'm doing masters in data science. So I'm interested into this group because I know that I will apply my knowledge. And also currently I'm working on my study where I'm trying to develop a model to predict treatment abandonment in pediatric cancer. So I know that this group will be very important for me. Thank you.
You need to choose someone else that you want him to hear, except read AI. This is not a real person.
For the moment. Yeah.
So I'll
One
choose
day,
Julia.
Yeah, Julia already did. So maybe someone else. If they open the camera, it will be great.
Shano, Islam.
Shanor, you here?
Maybe for the rest, if you prefer to present or give some sentences in the chat, as Anelia said.
Are you able to hear me?
Yeah, we can hear you.
Yes, Derek.
so
Go ahead.
My name is Derek Abila. I am a medical doctor and have a background in public health. I'm based at the Uganda Child Cancer Foundation in Uganda, which is part of the Uganda Cancer Institute. Yeah, I have interest in control of childhood cancers in our setting. Just eager to learn how to apply AI and what people are using in AI in cancer control globally. Thank you.
Brilliant.
Okay,
Now I can see Mitra here. Hi.
Yes.
Is it the right pronunciation? I hope.
Yes, Mitra. It's
Mitra.
No, you don't have to pronounce the H. It's Mitra. So I'm a radiation oncologist from Iran, a low middle income country. And to be honest, I'm interested to see how we can use it AI in the radiation oncology department. For example, we use it somehow in a contouring. And just in like this, maybe we could just have more patient to be treated. So I just want to see how we could use AI in our department.
I think it's a great opportunity. Yeah, Shanur is on. Hi, Shanur.
Maybe you want to introduce
do you
yourself.
hear me?
No, you are muted.
Assalamualaikum. Good evening.
Good
I am
evening.
Shanzu
No.
from
And now, do you hear me?
Bangladesh. I am a pediatric surgeon.
No.
I am the head of the Department of Sarsulimula Medical College, Department of Pediatric Surgery. I am working in especially for children with cancer surgery. And there is a team which is working multidisciplinary team approach is for this region as a teamwork, and a better approach, I need to know about AI.
Good input. Thank you.
Thank you,
Thank
Sandra.
you.
Is there anyone else who wants to introduce themselves? So maybe we can start, Uri?
Go
I
ahead.
think.
Yeah, go ahead. Go
Okay.
ahead. Yeah.
Because at the end we have only 1 hour of the meeting, if I'm not wrong. So I'm going to try to share the screen with really a short introduction, because the main dish comes from Jaques. Okay. And can you see my screen?
Yes, perfect.
So I'm really honored to present the second webinar. That is, as you said, it's not really only a webinar, it's a discussion in a close meeting with the people who engage in the group, trying to build it together. I'm going to make this brief introduction on behalf of the chairs, Uri Ilan from Princess Maxima Center, where he leads the AI innovation. I will say he's key in the trying to set up a platform where many stakeholders are invited. Friso Calkoen from the Department of Stem Cell Transplantation of Princess Maxima in the Netherlands also, and myself from Valdebrón Hospital. And of course, Jaques van Heerden, who is going to present a real exciting survey that he analyzed from the use of AI in Africa. So the agenda for today is just knowing each other as we have done right now, and also to present a brief summary of our purpose that we have been talk in the first webinar deeply, and we decided to work as a first step in the group, evaluating the needs, the gaps, the use of AI in the different continents. Because after the first talk, we saw that maybe the projects that we can develop from the SIOP are different from each continent. And first of all, we need to know what are the expectations and the use in each of the continents. This is the reason why also Jaques has been working in this survey in Africa, and I'm sure that we will highlight many issues to work on. And after that, we will like to discuss with all of you, and I will repeat, it's an honor to be with you from everywhere in the world, and it's really important to have your feedback to develop the same survey that we have been working on it on August for all SIOP, and then to work on the results. Because at the end, we would like to organize a workshop with where big tech companies could be invited to resolve what we prioritize in this analysis with these surveys. So this is the great block where we want to work on the first years, but of course, we want to discuss with you other initiatives, other projects that you think we can approach together from the SIOP. And we will close the meeting trying to prioritize all these issues, all these objectives. So just to remember the purpose of this group of AI in the SIOP, that is quite different from the innovation group, techniques group, is trying to know more how we use the AI and how can we improve the use of AI in the care of the treatment of patients, children and adolescents with cancer. How we want to do that? We want to develop it, taking in account the differences that we have in each country, whether the income is in these countries. And this is the best framework we can do it in SIOP. And how we want to focus all these projects with developing and creating this global hub where everyone is invited. You as a members of this group will decide with us where we want to go or how we want to achieve these goals. And of course, this is an open platform where we want to discuss and prioritize what do you think is the most important to start. So we want to do that through this networking, also with other stakeholders, not only with pediatric oncologists. We want, as the industry and the startup world, and we want to do education and training. I'm not an expert. Maybe Uri is more expert than me, of course. But here we are all invited to give our ideas and trying to resolve with all the experts in the field. So I'm not going to extend anymore, and I'm going to give the floor to Jaques van Heerden. He's the department. He's a PhD, MD, and professor in South Africa and also in the Hospital of Antwerp in Belgium. And he is the vice chair of Global Health in SIOP, and he developed with his colleagues this really exciting survey of AI that he's going to present right now. So Jaques, the floor is yours.
Can you just make me a host so that I can just share my
It's like, I don't know how you hacked it, but you in the people in the group, in the team, you are there 1, 2, 3, 4, 5, 6, 7, 8 times.
They probably have a link. So
You can try now to share, yeah, because the sharing is option only for hosts, but I just made you co-host. And...
Oh, okay. Great. Now I can probably do it. Wonderful. Can you see my picture?
Yeah, perfect.
Yeah.
This is probably my vision of what AI looks like in Africa. So I'm not sure if it looks like that. So just like Pablo, I can't claim that I'm an expert in AI. But what really came to me was that it is extremely important that at this stage in history that we engage with AI, whether we are scared or not, and that having grown up in Africa and done my education there, it was always kind of frustrating to trail behind the rest of the world. So I thought with some of my colleagues that we're going to jump in and do this survey just to start introducing everybody to AI and making them more comfortable. So it's very apparent that AI tools in medicine are rapidly increasing globally, and that there is a potential for it to also contribute to the successful outcomes and improving outcomes for children with cancer in all around the world, but also especially in lower middle income countries and continents like Africa. So the potential uses and limitations to implementing this is not well understood. And I think this is what Pablo said. It's the main thing that we're going to try and solve here is how can we use AI in our different settings. So this study was just like a baseline study to understand what people know about AI in Africa, how do they use it, and how do they see how it plays a role in Africa. So we created this 17 question survey that we send around to SIOP Africa members and our associate societies like the PROS group and IPSO and so forth. It was kind of mixed styled questions that were either multiple choice or multiple options and liquor types questions. But the bottom line was we wanted to test the knowledge of AI in Africa, how people are using it, and which barriers they are running up against to actually use this in their setting. So we had 138 respondents from 33 countries in Africa. I must say I'm very proud because in all the surveys I've sent out to Africa, this is the highest percentage of countries that's ever responded. So, and probably the interest shows the interest in AI. You can see the demographics for the languages is mostly the Anglo-Saxon countries, and followed by the French countries. And yes, we don't have a lot of Portuguese countries. I think there's 6 of them. So, but they also participated. And you can see the professions are quite widespread. So half of it was the pediatric oncologists that we could reach, but there are certainly some surgeons, radio oncologists in there, people from the laboratories like pathology, and then there's dietitians and allied workers in there as well, which really excited me as well. And the experience of these people, you could see it's a nice spread. So it's mostly the people that are the emerging or the young SIOP members, and then the people that are just outside of that spectrum, which is the 6 to 10 years, and then we trail a little bit down as people are mid-career and end-career participants or respondents. So the current personal use of AI in hospitals. So this was more aimed at if it's in the hospital and if you are using AI to do your work every day, you can see quite scarily it's still very high. 73.2% of people feel that they do not use AI in any part of their work in the hospital. 21% of the people were unsure if their hospital has any AI tools that they could be using, and 5.8% of them said that they do use AI. And as you can see, it was based on imaging analysis, predictive analysis, risk stratifications, and in the pharmacies, to test your drug interaction detections, and then chatbots. So my interpretation of this is like there's really at this stage a very low uptake and awareness of the role of AI in current clinical use. So for not clinical use, so that is research and, if you do your education systems. So there it was quite higher at 68.8%. And I do think everybody was going like, oh, how do I do my CV? Or can AI quickly do my PowerPoint for me or something like that? Like what research questions can I think of? So you can see that it was primarily about creating educational content for research purposes in clinical trials, how to screen patients or randomize them, and then probably for the meeting summaries like our participant read AI meeting notes at the moment is also part of this discussion. So the interpretation here is like all other things that AI use is higher in the education and research part before it actually goes into the clinical setting. So currently to this, you can just, when we ask people, so what do you think is an impact of AI tools in your daily practice? You can see that 54% said, well, it doesn't really impact my daily work because about 73% of them actually don't feel that they're using AI in the work. And the rest, as you can see, most people said they felt that it was a low impact, and that correlates to the more or less 20% of the people that, possibly didn't know if there was any AI use in their hospitals. So the interpretation of this is that currently AI hasn't ciphered through to the clinical responsibilities of people in their daily practice. So for them, it wasn't of any vital importance. So then we went like, okay, well, if you're not using it, so outside of this, how do you know anything about AI and the different the tools that you have? And you can see that none of the tools that we mentioned were more familiar than 10%. So familiar or very familiar. So the rest of it was the majority had basic knowledge or no knowledge of any of these tools at all. And it was very funny. I got an email afterwards from somebody that said, like, after having done your survey, I now know how little I know about AI. So at least my survey had that purpose. And then, so asking about the barriers to the adoption of AI, you can see that it compares quite a lot to a lot of resource associated constraints. And as we can see, the infrastructure isn't there. You know, are the data there that you can actually train your AIs? The costs, do people actually know how to use AI? And then on the other side, it is culturally or ethnicity related. So, for instance, like we always know that our French Africans and our Portuguese Africans say, like, when are you going to start doing some webinars in French or in Portuguese when my language is up to standard? But so it's also dependent on your setting itself, how you can access these things and how you can interact in it. But very interesting is like the distrust of AI is at least 50% of the people. So that is, so fear is very prevalent in this decision, and it just boils down to, so if we are going to have to interact with AI in Africa, there's a lot of limiting factors that's not based in what resources alone, but it's the interaction and the cultural aspects of it as well. So if we had to implement AI in Africa, I don't think this is a surprising result. It would arrange around getting the infrastructure up, training people how to use it, getting policy frameworks around that, especially if we think about the trust factor, about the ethics behind it, data sharing, how do we do all of that? Because if we're just thinking about sharing images, how do you do that in a safe and ethical way? And then obviously having access to all of these things, the payment of that, keeping up the infrastructure and so forth. So and then how do you integrate that into your hospital systems? So there's a very high need for investment into all aspects of AI to be able to do this. So, but the thing that was quite encouraging is, despite all these limitations and the distrust, you can see that at least 75% of people were very willing to start using AI in whichever way that they needed to fulfill their training or their clinical tasks. So not just is awareness really important to help people get there, but then also to train them. And it seems that people are very willing to do so. Then I did a few varied analyses that came up with some interesting aspects. So there is an increasing familiarity with AI tools with an increasing income status. So that also tells me a little bit like the more resources you have, people probably have more access to it. They are more familiar. They work more with it. And the inverse is also true. So the rate of perceived impact decreased with a decreasing World Bank income status. So those are probably the people that don't have access to it. So if you can't access it, you can't use it. So the impact would also probably decrease. So so there was the other variants that really had that was significant as a clinical role. So the different people that so for instance, certain clinical roles use AI more than others, and that came through very, very clearly. As I explained earlier, so the clinical experience of the people, so the younger generation seem to be more interactive with AI, and that would also correlate with their knowledge. But so there was also then, as we would think, like with increasing years of experience, those people felt that it had less impact into their daily tasks, probably because they already know how to do their work and they probably not amenable to change, or they don't know how to interact meaningfully with AI at that stage. So then when looking at the clinical roles and what type of tools were used, you could see that clinical researchers obviously used the tools that were used in their study settings. The laboratory technicians obviously worked with more image-related tools, and then the pediatric oncology fellows for their education and their research purposes, because it's expected from their curriculums. So I thought that maybe the radiologists would be right up there using the imaging tools, but it does seem like the pathologists and the lab technicians are the ones that's using most of the AI tools, imaging tools in Africa. So another probably this is my perception was I thought that the surgeons would be more into robotics and so forth, but that wasn't true. But thinking about it, I thought, well, it's also really expensive to acquire robotics, so that was probably the connection with resources, that if you don't have the resources to invest in those robotics, then your surgeons probably would not have access to that. So the question about where would you want AI to help you with, you can see what I did on the right hand side is probably how people perceive where that could be helpful. So I'm not going to run through that, but you can see on the left hand side that it is in most of the spheres of pediatric oncology, starting from your pre-diagnostics, going through to risk stratification and your management, and then also the research, training, and logistics parts. So another quote that somebody wrote down was they would like to use AI tools in an where you could automate something without the need of human intervention. And that made me think a little bit like that, so we do have limited knowledge of what is going on, or where we could use AI at this stage, and people are quite distrustful of AI. And just like most settings, it's in the research setting where it is picked up directly. So, and but all people, no matter where they are in their career, thought it was really, really important, and that resources would be the biggest limitation, and the knowledge is in proportion to who uses it, what they use, and how often they use it. So if I can conclude with two last slides on my observations, is that the need for developing AI tools in Africa is really where there's a shortage of workers and skills that people need extra support in. And when I did this this exercise with my two investigators, we really thought about, if AI could make your data sets for your studies and analyze it and then give you a report as a automation, that would be really good. Or where tests could be interpreted and so forth, that would be really, really important. So what I also was thinking is that factoring in the resource thing, the resource factor is, I was wondering if in the African setting, AI is viewed as a mechanism to replace where resources are inequitable, to leverage the inequality that Africans work with. But what also became very clear for me is that it also depends on what you put in is what you get out. So we must be very careful about the quality that goes in, but also be cognizant that it is really important not to just extrapolate data from one part of the globe and think that we can apply it to another part of the globe. So we must be really bad. Whatever your definition of bad data is like one of the pathologists one day said to me, bad in, bad out. And we really want to make sure that we limit that. So with that, I just want to acknowledge my two co-investigators, Jennifer Hill and Laura Sundry, and also then everybody that participated in this survey. I'm very glad that so many people had interest in it. And then I also want to thank Uri and Pablo and the AI working group for jumping on this with so much enthusiasm and that giving Africa a place. Thank you very much.
Thank you, Jaques, for this wonderful presentation. I think that you made in a really short time a great project with this survey, and you gave to us really important inputs about where we can focus to work on together, and also with the experts in the developing of AI. You talk about how in Africa people are using the AI for education and research, and as you mentioned, I suppose that they are talking about large language models, not the other algorithms that we've been talking about image and other resources for AI, and how low is the impact right now, but how interested are the people in working on increasing the usefulness of AI, and as you say, how we should be sure that the algorithms are working with the right data, and maybe this is one of the frameworks of SIOP. Ensure that the projects that are currently on developing from these big techs and also from the academical projects are working with the data that is going to give us the global picture and the answers for all the patients that we have for the low, middle, and high income countries. So I will suggest the group to ask direct questions to Jaques about this survey, but also to give us your input about spreading the survey to all the centers. Right now, if I'm not wrong, SIOP just sent the global survey, was based from this one in Africa with some of other questions. So do you think that it will be worthiness to spread this survey to all the SIOP countries, SIOP continents, and what we will do with this information, with what will be the next step? Jaques, Uri, Friso, me, we were talking about engage also the Microsoft, Google, OpenAI, trying to resolve these questions with the leaders of SIOP, but maybe we should split it in the different countries, not doing a whole workshop, or maybe we should also focus not only in large language models, also in diagnosis and image. So many questions, and I will like to let you discuss your point of view of the survey and other strategies that we can develop from your countries. So please go on and give your opinion, please. Uri.
Yeah, no. So it's I cannot say this is an open discussion, and the main point is first, as Pablo said, that we send a survey around the world to hear more. But we would really like taking into account the survey and what we said, the aim of the group. How do you think we can help you? Because we cannot solve all the problem. We need to pick our battles. So I look at the survey from Jaques and I see that the main problem is infrastructure. And this is something that unfortunately outside the scope of our group. We cannot build a new internet post. We cannot give phones. We cannot give laptops yet. But so what will be the next step? What, in your opinion, in your countries, should be the next step? Yeah, Julia, go ahead, please.
Sorry, I'm just going to say from a background point of view, congratulations, Jack, on getting the participation that you got, because traditionally surveys have been dismal coming out of GHN, Global Health Network, and before that, PODC. I think too that many of the people in low and middle income countries say, we fill out the survey, but then nothing changes. You take our data and nothing changes where we live. So I think we should be, and because of that, for a while at PODC, we said no surveys, because it was easy for people to create a survey. Then they wondered why they got a less than 10% response. And even if they got more of a response, there was no change. It didn't change anything. So I think the power of this working group would be to see, and I think Uri, your approach is right. Like, what can we influence? What can we do that would make a difference with at the moment, no funding, but with obviously interest, because people are signing up. They came to the first webinar. But the question, I think the more sophisticated question is, based on what Jaques found, because we always say Africa is one of the hardest places to get information out of. You've got this solid information now. How can we build from that? And when you look at SIOP Asia, it's enormous. It includes all of the Eastern Mediterranean as well, and all of EMRO. So if you have such a global landscape, and you know that GHN is focusing on low and middle income countries, or let's change that to resource limited settings. Where does it begin? Where did it begin in high income settings? Where do we see openings? And I think if we start small, we're likely to be more successful and build on it from there, get buy-in. And then finally, I'm going to say you have an incredible opportunity in Amsterdam, because you have this is going to be one of the biggest conferences that we're going to have for years, because the next one is in Texas. So we know that visas to get into the United States are going to be super challenging for LMIC folks, resource limited folks. Then it's going to be Sydney. So it's going to be very expensive to fly to Sydney. So I would say this is your moment to grab the attention and get a nucleus of people who you could survey in person. I mean, that's different. We're all sitting in the room waiting for the slideshow to begin. The old paper and pencil way used to work, or you can do it on a QR code. Shoot this QR code. Or you could ask them to put it in the rooms when they're got the slides sitting in the room as people file in and out. People are bored. I mean, they'll take 2 minutes and do a survey on a QR code if they don't have to, and a Google form. Do you know what I mean? So you might have 3,000 people coming to this or more. So here's your chance to grab people in person. Maybe you want a free room. You can talk to Suzanne, the CEO. They were giving away rooms for people, and maybe you say, people come together. We're going to be there at that time. If you want to come in person, we want to keep going, because I think that would be an opportunity you might consider.
I think you gave such a great ideas, and this is exactly the point where we are here. First of all, I want to hear solvable problems, something that we can target and solve. And this is one of the aims, because I really would like to hear those guys. I don't see the cameras on, and I see a lot of Jaques, to be honest. Jaques, if you open your camera, I will have 12 Jaques here. But I really want to hear from, and you gave a great idea, I think, to do this. First of all, we did booked kind of a small event, like a 15 minutes, but I think to make a inloop, it's in Dutch, walk-in event that people can come and talk to us, and also to create a survey online. And I don't know if the guys are listening, but we also have AI evening that Google gave us their offices, and we will do it in Google in Amsterdam with a networking event, and then some presentation about what's going on and how we can try to solve those problems. All of the people, everybody's invited to sign up for this. Of course, it's free. But great input, Julia. Perfect. Thanks.
So first, I want to apologize. I just realized that when I asked all the SIOP Africa members to please join the meeting, instead of sending the ad around, I sent my own link. I'm very sorry. That was my mistake. Yeah, sorry. So you can see I'm not even AI minded or technologically minded. Give me a pen and paper, just like Julia said. But I think the first, from what I learned from this survey, and I mean, anybody can jump in after me, and I think the first thing that we can solve here is that maybe the ignorance, the fear, or the lack of knowledge that we have of AI, we can solve. And that is the very first thing that we need to do. And the more and more I started reading, I went like, aha, you can connect that to that, even if you do not have the resources. So, so Pablo, Uri, I do think that solving the lack of insight is the first problem that we can solve probably in a very practical way, and then showing people how they can use certain things. Uri, I remember when you showed us in Belgium the thing that the program that you solved, and how it did its own multidisciplinary team meeting. That was really an eye opener, because I think at this stage we don't know what we don't know. So how can we talk about that if we don't know what we don't know?
Yeah, that's a great question. I just wanted to let you know about your presentation. In AI, we said crap in, crap out, not bad in. So crap in, crap out, just to let you know.
I was being
but-
politically correct. I wasn't sure if I could offend people.
So you can put the emoji next time. But this is actually very important for us, and I think we want to make people dream. And in my opinion, this whole concept of the group is that let's say the high income countries will lead the development of tools, but talking to low and middle income countries to find out that their tool they are developing is also suitable for them. And also trying to get data when you train your models from low and middle income countries when you are applying for a grant, when you are building a new model. Now we're working with Google Research on multimodal analysis of MRIs and genetics of brain tumors. So we need to always have in mind this low and middle income countries and how we can actually extend the model. And we will be in the lead of developing, but we want to hear from other places what are the needs, because our needs in the Princess Maxima or in Belgium or in Barcelona are totally different than what their needs. So if someone wrote to me now training in AI, it's really important and it's easy task to achieve, because Google are already happy to give free courses for SIOP members that are in the AI working group with certificates. So you can do the training and get certificated you did the training in AI. So this is something this is the whole concept of what Pablo meant, is we're here to listen to you. We will be the link to the big tech that has the money, has the capability to help, and we will try to link them to specific projects per continent. And we really want to hear from you. So it is an open discussion and open suggestion, and just speak your heart out.
Jaques, thank you for your presentation. I really enjoy it, and it's very interesting. Coming from low and middle income countries, and echo Julia's thought about many surveys and the survey fatigue. I like that you only have 17 questions. I just wanted to highlight that.
I couldn't think of any more because I don't know that much about AI.
Okay, and I wish we could have less. I mean, and that is a big, a big task, is how much is enough? What are those key questions that we really need to know to move into action? Because I also love your thoughts about we need to do something with this, not only, get the responses and that's it. I put it on the chat that one low-hanging fruit, I see it, is training. This is new for all of us. We started very skeptical, and now, like me, I'm all over with AI and want to learn. Time is not enough for everything that I want to learn. And at the same time, I know that there's many resources and courses around there, but I wanted to know, I would love to know which of them are specifically to what we do in healthcare. Not necessarily childhood cancer, but in healthcare, what are those trainings in AI that can help us, implement these AI tools into the clinical practice, but also in the daily practice, like management, research, education. So I think that's one. And then with the time, this like models for decision making. Actually, I'm going to do a scoping review on AI to predict imminent death for children with cancer, because we don't have a good system to predict imminent death. But I believe there's many other options that we can do. So training, I think, is one of the most feasible one to start.
Yeah, I think this is the basic, and I believe with education you drive culture change, right? And this is exactly one of the topics that we would like to start with.
Great.
And I would like to highlight what Jimena said, that we need to do something, one training focus of what we need. I mean, there are many trainings, but do we need to make prompts? Maybe not. I mean, I remember I'm old, and I remember when we started to learn how to program in the system, and then Mac came and make a friend user software, and so what us as a clinicians need to train on. I think this is one open question. I have not it really clear, and of course there are many questions rise from this survey and from others that came about the ethical, the regulatory. I know this is boring, but still, this is one of the things that make us reluctant to use the AI. So for sure, I think this should be in our training when we decide to use one of these tools for our decision-making process. So I think that this is also a discussion to have with these platforms, to have some training, but the real training that we need. Jimena, I will say, I love when you talk about the questions, the key questions that we should we should ask. Maybe we made a huge survey from SIOP when we used this from Africa, and we completed it. And I post in the chat the survey that we want to spread in SIOP. Would you and the rest of the group just take a look, please, and came back to us? It's in the chat, and only 2 persons has answered it because it was sent less than 1 week ago, but it will be really nice to have your feedback before spread it, and we really can change it in the next few weeks before give it to SIOP and other networks to have the answers from everyone.
Yes, Pablo, happy to do it. I already opened it. So you want me to fill it and also provide feedback, or just
no more from this group? I think it's better to have the feedback if we should change or sort any question, and because I think it's a huge survey, but we wanted to focus it to have all the insight from different countries and continents. It's more to change the survey before spreading it.
I think Pablo Julia gave a great idea to create a QR code for this survey and just put it. The Dutch people are really keeping the rules, but I don't, so I can just put it everywhere in the conference, and people will scan it when.
Amelia is here.
Oh, sorry.
Yes. Okay, yes, but of course it's a great idea, and we will try to the QR for SIOP with the SIOP organizers.
Uri and Pablo can walk around with T-shirts with a QR code on it, and everybody will scan it, and they will want to find out what it is. So,
that's a great idea.
Jimena, I just wanted to say to you I think the other thing, and Julia, the other way that we got so many people to do the survey was that it was then linked to a follow-up question to ask, do you want to be part of SIOP Africa's AI working group? So they knew that by doing the survey, that would automatically be their option to opt in or opt out to be the leaders to start doing AI. And one of the questions was, so what can you contribute, and what do you think we're going to need AI for? So you already put them to work. So maybe that would work in other situations as well.
Yeah, and I wonder if I think Julia gave a few suggestions in the chat. I think most of the answers are yes. There's several factors, and in the AI working group, we'll bring startups who might target those questions, and there are also the startups that will be presenting during this the SIOP AI are willing to collaborate with low and middle income countries. They're open to suggestions like this. One of them is already created the guideline of the South African Medical Association as AI chatbot. So that would be a surprise there. But I want to hear others. I don't know if any other want to participate. How we can help you use AI better, how you can help you, what is your needs. For us, it's really important to hear you. Maybe yeah, Jaques, you raise your hand. Oh, there's another Jaques. Okay. So
Well, you know, I'm just going to do it like we do it at SIOP Africa. Vivian, you always have great ideas from Ghana. Where do you think in Ghana they would need AIs?
Hi, good afternoon, everyone. Good afternoon, Jaques. This really puts me on the spot. For AI,
no.
I believe that as pediatric oncologists, if we can get something to help us, possibly in pulling out all our different, I don't know how AI can do it, but getting good literature from all the different sources, especially if we want to review, we have a very difficult situation or a very difficult case, and then we want all the literature that can help us in managing that patient. At times, getting all these, because a lot of the time, some of us don't have full access to all the different the different systems. It might be good to put all your questions in AI and then get it all churned out. I think that can be one way to use it. And then we have been using it to answer lots of our questions. You can just put it in, you have some questions or some ideas, you put it in, and then AI refines it a bit for you so that you are able to use it. And I believe we can continue using that. But I think the best will be for us to also get a lot of education about it, because we started using it without really knowing lots of things. And so that educational component of it might be very important for us so that we'll be able to use it well. Thank you, anyway.
Vivian, great input, to be honest. And during this, again, during the AI event, you'll find a good solution for your question. Of course, and Jaques created the main question: crap in, crap out. What is the reliable data that we are allowed to look into? Yeah, how do we actually define what is reliable, what is not? But it's a great question. Yeah, there's someone with Jaques with the hands on. Is it you, Jaques, or is it someone else that you gave the access to?
Someone else that hacked my
Okay, the hacker can ask question. Go ahead.
So this is Nihad. I'm the other Jaques.
Nihad is also
Good
from
afternoon,
Ghana.
everyone.
Everybody,
Yes.
this is a superstar. You need to listen to her. She was the very first rising star from SIOP Africa. Go, Nihad.
Jaques, I'm getting tired of this. Anyway, so my question is, currently in most parts of sub-Saharan Africa, we don't have pediatric cancer registries. Some of us are now trying to establish some hospital-based registries. Now, we have in Ghana, we have electronic medical records that sometimes we want to just pull out specific data that we need. I'm just wondering whether AI can be the way to go with the current system that we have in place, and so we have well-established registries. Thank you.
It's such a great question. You know, it's not actually a question for Ghana, it's a question for the world, because every hospital in Europe has their own database, and it's different from the hospital that it's the database next to them. And we are trying to find a way to use AI to structure data into a searchable database. So we changed the database into something more searchable, and that's also include EMR that we don't know about. So this is something we can try to tackle. This is a great idea.
And still, we have been working with that also in Europe with Uri and the BFM group, and still is a challenge for us about the where is the data located. This is a really a legal important problem, and the confidentiality. And I think that is a main question to talk about in this project.
So Pablo and Uri, I see some of the African pathologists are here, so Kosovo is here. So how easy is it to use pathology slides and make up a data bank? And because and I was hoping Vivian was going to jump into this, but we do think that Wilms tumor in Africa is different than Wilms tumor in Europe, and I really am hoping that AI can help us show those pathological differences. Do you think there's a place for that?
Of course, this is great and depends on the slide. Like, do you have it on a digital form, or do you really have the slide that need to be scanned and then etc. and then been done? There are many pathology models existing now, and you're right that we don't have the data from Africa. So there is an opportunity to create a project like this. To be honest, that will be some of interest of other AI techs, because if you supply the data, they will create the model for you.
Maybe this point comes to that we can invite in the future some startups that has been working on it and have developed some kind of model to analyze the images from radiologists to pathologists, and maybe we can start a discussion in a common meeting about integrating different images from different countries.
So Uri, there's a question in the chat that says, can you use AI to create standard courses in areas such as pharmacometrics, pharmacokinetics, and therapeutic drug monitoring? And then I want to add on there, that's not the result of hallucinations.
The courses are not hallucination, or the question?
Well, the courses. No, I didn't hallucinate the question. It's right there. You can see it.
Yeah. So, yeah. Well, I'm not. I have to say that this is not a typical field for me. But this is something we can look into. This is, of course, Pablo, myself, and Friso are pediatric oncologists, and we are lacking also the overview of the other entities. So I was happy to see that Mitra was here from the radiology and also other entities, so they can help us understand better what are the problem in multimodal way. And we need to look into it. I'm not familiar with courses that are so specific, but if the question is, can you create courses? This is something that is highly interesting, because I don't know if you know, but several companies invested billions of dollars lately in education. It's becoming a hot topic with AI. And I think if we can come up as a SIOP Africa with a nice suggestion, this might be of interest.
We talk about education, registries, data, research, images.
From the top of my head, I was just remembering there was a comment in the survey itself where somebody asked or suggested that AI is used for early detection and transfer of patients to get treatment. I'm not really insightful enough to make the connection with AI. Can you guys think of a connection?
Not at the moment, but we can dive into it. It depends what the data needed, where the connection, but we can dive into it. But is it really a problem? Does patient in Africa move from site to site in order to be treated?
Well, it's not about that. I think that the problem is that somebody presents, for instance, in a primary clinic that is like 500 kilometers away from where the cancer center is. And then that patient is sent to the local hospital, which is like a general hospital. And then it's sent to a pediatrician. And then the pediatrician goes, oh, but this needs to go. So I think it's about the transfer of the patient within the health system to get to the place where they could get the proper care.
Yeah, this is interesting.
This is a really good
In my
point.
Yeah, I think everything can be done. To be honest, everything can be done as long as the data exists. Any more question? Any more comments? Because if not, I think Pablo, we are above the hour.
Yeah. So, do you think my last question is we definitely the highlights or the prioritization should be in education, research, data, images, also transfer and cross-border health. And do you think, using the same words as Julia said, is that develop or organize a meeting, a workshop with the big tech companies? We will try. I don't know if they will allow, but with the data that we can retrieve from this global survey, maybe there will be a win-win interest. Maybe this is a low or a middle high step. Could we start talking about what we need, select the people that has been answered, the people who is involved in this group, and trying to organize a workshop with them in the 2026? Do you think this will be a first step that could be worthiness? I'm talking about Google, OpenAI, DeepSeek. Is feasible, Uri?
Well, everything is feasible. One of the topics that I see is that a lot of people has the barrier to work with those big tech companies because of prejudice, although my experience is totally different. And there are some, of course, every company is different, but some of those companies have a very big will to help those countries. Well, if you look at along the way, they might benefit from it, yes, but they also will help us stand on our feet. And this is how I see it. And even us as the Maxima, if we are, let's say, one of the biggest centers, we don't have the capability to program. We don't have we don't have engineers. We don't have anyone to build for us AI tools. So we have to outsource it in a way. And I see this collaboration as a win-win. You know, they get a nice impact. We get the next step in medicine.
Great. So I think with this summary of the ideas that we want to prioritize, with this timeline of our working shop for the future, we can let the discussion for the SIOP in Amsterdam with the QR that we are going to put everywhere, and then with your feedback about the survey. I think that SIOP Amsterdam will be the best place to spread the survey, and with the results we can organize this next close meeting for this group and the next steps for the workshop, if it's okay for you.
Yeah. Pablo, I will also suggest one thing that because Jaques presented the very nicely the presentation, there were a lot of people from Africa, and I wonder whether we should do a more targeted approach toward each continent as AI working group, because we heard a lot about Africa, but we might be more targeted in the future.
Well, you guys are invited to SIOP Africa in April next year.
Yes, I need to give an answer, I know.
No, that was not why I said it. I just want to make sure that you come.
It will be a pleasure.
Thank you very much. But thank you everybody for participating. If you feel uncomfortable to answer here or not, please feel free to go in the working group, the SIOP Connect, post it, contact us. We will be happy to hear. And if you are in Amsterdam, join us in the AI group. We will be the guys with the QR code.
We'll see you there.
Thank you much,
Thank you,
everyone.
Thank you.
Bye.
Thank you to all the Jaques van Heerden.
Thank you.
Bye.
Thank you very much. Bye-bye.
Bye.